Here's your new script in English, continuous, conversational, and ready for voiceover on penis enlargement, what actually has evidence versus what's just hype. If you've ever typed how to make it bigger into a search bar, you already know the internet is a jungle of miracle pills, dangerous hacks, and before and after photos that look more like lighting tricks than real anatomy. Today you're getting the calm, clinical breakdown. No fluff, no scare tactics, what works, what doesn't, and where the real risks live. By the end, you'll know which options have data behind them and which ones are just smoke. First, a quick reality check that's more important than any device or procedure. Most men who worry about size are actually within the normal range, and body image anxiety can make a normal penis feel inadequate. The current European guidelines literally recommend objective measurement and, when size is normal, psychological support before procedures, because chasing a number without fixing the perception rarely ends well. Hormone therapy doesn't increase size after puberty, so don't waste time on that unless you and a doctor are treating a specific endocrine disorder. PubMed, Mao, Wine. Now let's talk about length gains. You can actually measure in centimeters, not in wishful thinking. Penile traction therapy, think of it as gentle, controlled stretching with a medical device, has the best non-surgical evidence for small but meaningful length increases over months. In the best-designed clinical trial using a modern device, men who wore traction around 30 minutes a day saw average length gains of roughly 2 centimeters, alongside improvements in curvature for men with Peyronie's disease. That's not a fantasy number. It's a number with randomized trial data and safety outcomes to match. The gains came from consistency, not hero workouts, and the side effects were mostly temporary redness or discomfort. In PubMed, if you're wondering about vacuum pumps, here's the nuance. A vacuum erection device can temporarily make you look larger because it draws blood into the penis. That's why some men use it before sex or photography. But that's a temporary hemodynamic effect, not permanent growth. Where it does have a medical role is in rehabilitation after prostate surgery. Early structured use may help preserve function, and in some studies, help preserve length that would otherwise be lost during recovery. That's a different goal than permanent enlargement, and it's important not to blur those lines. PMC. There's also the hidden length problem no one on Twitter wants to talk about. When suprapubic fat pads spill over the base, a normal length penis can look shorter. In men with a buried or concealed penis, often tied to obesity or scarring, targeted weight loss, skin reconstruction, or fat reduction can dramatically improve visible length and hygiene. That's not enlarging the tissue itself. It's revealing length you already have, and for the right candidates, it can be life-changing. PMC. Now, girth. If you've seen those jaw-dropping before and afters on social media, they're usually from injectable fillers. The product with the most clinical data is hyaluronic acid, a gel that can add measurable circumference for months to a couple of years, with the benefit that it can be dissolved if needed. A recent meta-analysis pooling randomized trials found hyaluronic acid outperformed polylactic acid for girth gains and short-term sexual satisfaction. That's real signal, not just testimonials. But this comes with caveats. Placement technique is everything. You need a qualified specialist, and you must accept trade-offs like touch-ups and the possibility of nodules or asymmetry. PMC. Here's where things get dangerous fast. Unregulated or permanent substances, silicone oils, paraffin, industrial fillers, or DIY injections have a long, ugly history of complications. Chronic inflammation, deformity, infections, skin loss, even surgical amputation in catastrophic cases. The literature is crystal clear on this. Complications are common, and many patients need multiple reconstructive surgeries to undo the damage. If anyone offers you a permanent injectable bargain, walk away. Nature. Surgery exists, but it's not the simple cut and add 3 inches myth. The most talked about operation, suspensory ligament release, can increase flaccid or stretched length, especially when combined with diligent traction afterward, but it doesn't reliably increase erect length. Satisfaction is variable, and complications rise sharply if you skip careful selection and post-operative protocols. Contemporary reviews of cosmetic penile surgery emphasize exactly that. Proceed only after thorough counseling with realistic goals and in experienced hands. For men with true buried penis or severe curvature, reconstructive or Peyronie's surgeries can restore function and perceived length, but that's a different medical indication than cosmetic enlargement. PMC. You may also have heard about specialized cosmetic implants for flaccid enhancement. Some series report high satisfaction for appearance, but this is real surgery with real risks. Device exposure, infection, reduced sensation, curvature changes, and reoperations are all on the table. If you're not prepared for that full risk-benefit conversation with a board-certified surgeon and the possibility that your erections won't look the way Instagram promised, don't let marketing push you into an operating room. Pumps nicer. All right, let's clear the smoke. Pills and natural growth supplements do not lengthen a post-pubertal penis. They might improve erection quality if you were deficient in something or if they act like a mild vasodilator, but better blood flow isn't the same as tissue growth. Manual jelqing routines are heavily promoted online, but there's no high-quality clinical evidence of permanent enlargement, and aggressive friction or pressure can injure the tunica and blood vessels, setting you up for pain, curvature, or erectile issues. Guidelines don't recommend it. The best they say is that traction and selected surgical techniques may help in specific contexts after careful evaluation. PubMed. So what's the smart, evidence-based roadmap if size anxiety is affecting your confidence or relationships? Start with facts. Get an objective measurement, stretched length and mid-shaft circumference, by a clinician so you know your baseline. If you're within the normal range and the distress is high, combine sex therapy or body image counseling with practical tweaks that make a visible difference. Grooming, weight management, and erection quality optimization. If you want modest real length gains and you're patient, a medically approved traction device used as directed for months is the conservative path with the best safety evidence balance. If your priority is girth and you accept maintenance, a hyaluronic acid filler performed by a qualified urologist or dermatologist can create noticeable, reversible change with a defined risk profile. If you're considering surgery, make sure the indication matches the method: curvature correction, concealed penis repair, or carefully selected cosmetic cases, and get second opinions from surgeons who also do reconstructions, not just enhancements. And across all of this, never let anyone inject a permanent or unregulated filler into your genitals. Never let anyone promise inches in weeks, and never confuse a better erection with permanent growth. One last thought that isn't medical, it's human. Confidence isn't a number, it's a system. How you talk to yourself, how you show up, how you treat your partner, and how you steward your health. If you pursue an intervention, do it with clear eyes. Small, incremental gains plus better function and better self-talk can do more for your sex life than any viral miracle. That is the honest, evidence-based bottom line. Sources for the key claims above include contemporary guidelines and peer-reviewed studies on traction therapy, fillers, reconstructive indications, and complication profiles. Representative examples: randomized traction outcomes and typical 0.2 centimeters gains with consistent use. European guidelines emphasizing measurement, counseling, limited role for endocrine therapy, post-puberty, and cautious selection for surgical options. Meta-analysis showing hyaluronic acid fillers increase girth and short-term satisfaction versus polylactic acid. Severe complication rates with non-medical or permanent injections, and the role of VEDS in rehab versus the myth of permanent pump growth. PubMed. If you want, I can tailor this into a 12-15-minute version with stronger hook lines and retention beats for YouTube, or expand it toward the 25-30-minute format with more Q&A moments, on-screen cautions, and B-roll cues. https://pubmed.ncbi.nlm.nih.gov 377-099592 European Association of Urology Guidelines on Penile Size, Abnormalities and Dysmorphophobia, Summary of the 2023 Guidelines, PubMed, https://pubmed.ncbi.nlm.nih.gov 332-23425 Outcomes of Restorex penile traction therapy in men with Peyronie's disease. Results from open-label and follow-up phases. PubMed. https pmc.ncbi.nlm.nih.gov. Articles. PMC 4708600 UTM source ChatGPT. Com. The Science of Vacuum Erectile Device in Penile. https pmc.ncbi.nlm.nih.gov. Articles. PMC 8261441 UTM source ChatGPT. Com. The Concealed Morbidity of Buried Penis, a narrative review. https ipmc.ncbi.nlm.nih.gov. Articles. PMC 10473315. Efficacy and complications of hyaluronic acid and polylactic acid for penile augmentation. A systematic review and meta-analysis. PMC. https www.nature.com. Articles. S41443 023 0675 8. Complications and outcomes following injection of foreign material into the male external genitalia for augmentation. A single-center experience and systematic review. International Journal of Impotence Research, https://pmc.ncbi.nlm.nih.gov. Articles. PMC 123079 UTM source and ChatGPT. Com. Techniques for penile augmentation surgery, a systematic. https://pmc.ncbi.nlm.nih.gov. Articles. PMC 145694 UTM source ChatGPT. Com. Outcomes and patient satisfaction after pneumosilicone.